myocardial infarction, heart attack. 1. A 60-year-old man presents with crushing chest pain radiating to his left arm and jaw for 45 minutes. ECG shows ST segment elevation in leads 2, 3, and AVF. What is the most likely diagnosis? A. Anterior myocardial infarction. B. Inferior myocardial infarction. C. Lateral myocardial infarction. D. Posterior myocardial infarction. Correct answer B. Inferior myocardial infarction. Explanation: ST segment elevation in leads 2, 3, and AVF suggests an inferior wall MI, which is commonly due to right coronary artery RCA occlusion. 2. Which of the following cardiac markers remains elevated the longest after a myocardial infarction? A. Myoglobin. B. CKMB. C. Troponin I, lactate dehydrogenase, LDH. Correct answer C. Troponin I. Explanation: Troponin E rises within 3 to 4 hours, peaks at 24 to 48 hours, and remains elevated for 7 to 10 days, making it the most sensitive and specific marker for MI. At 3. A patient with an anterior wall MI develops acute heart failure and shock. Which artery is most likely occluded? A. Right coronary artery, RCA. B. Left anterior descending artery, D. C. Left circumflex artery, LCX. D. Posterior descending artery, PDA. B. Left anterior descending artery. Explanation: LAD occlusion causes an anterior wall MI, ST elevation in V1, V4. This often leads to severe left ventricular dysfunction, increasing the risk of cardiogenic shock. 4. A patient with a recent inferior MI presents with bradycardia and hypotension. Which of the following best explains this finding? A. Left ventricular failure. B. Papillary muscle rupture. C. Sinus node dysfunction. D. Increased vagal tone due to RCA involvement. Correct answer: D. Increased vagal tone due to RCA involvement. Explanation: the RCA supplies the sinoatrial SA and atrioventricular AV nodes. Inferior MI RCA occlusion can cause bradycardia and hypotension due to increased vagal tone or AV block. 5. A patient is diagnosed with a posterior myocardial infarction. Which ECG findings are most characteristic? A. ST elevation in leads V1, V4. B. ST depression in leads V1, V3. C. Q waves in leads I and AVL. D. T wave inversion in leads 2, 3, and AVF. Correct answer B. ST depression in leads V1, V3. Explanation: posterior MI due to PDA occlusion presents with ST depression in V1, V3, which represents a mirror image of a ST elevation in posterior leads V7, V9. 6. Which of the following is the preferred initial treatment for a patient with an ST elevation myocardial infarction, STEMI, within the first 2 hours? A. Thrombolytic therapy. B. Coronary artery bypass graft. C. Percutaneous coronary intervention. D. Beta blockers. Correct answer C. Percutaneous coronary intervention. Explanation: primary PCI within 90 minutes of hospital arrival is the gold standard for STEMI treatment. Thrombolytic therapy, TPA, is used if PCI is unavailable within 120 minutes. 7. A patient presents 5 days after an MI with severe chest pain that worsens with inspiration and improves when sitting up. What is the most likely diagnosis? A. Ventricular free wall rupture. B. Dressler syndrome. C. Acute pericarditis. D. Aortic dissection. Correct answer B. Dressler syndrome. Explanation: Dressler syndrome is a post-MI autoimmune pericarditis that occurs 2 to 6 weeks after infarction. Presents with pleuritic chest pain, fever, and pericardial friction rub. Treated with NSAIDs, e.g. aspirin, colchicine. 8. Which complication is most commonly associated with a myocardial infarction involving the left circumflex artery? A. Cardiogenic shock. B. Mitral regurgitation. C. Left ventricular free wall rupture. D. Lateral wall infarction. Correct answer D. Lateral wall infarction. Explanation: the left circumflex artery, LCX, supplies the lateral portion of the heart. ST segment elevation in leads I and AVL, V5, and V6 suggests lateral MI. 9. A patient with an MI presents with sudden onset of a new holosystolic murmur at the apex and pulmonary edema. What is the most likely cause? A. Ventricular septal rupture. B. Papillary muscle rupture. C. Free wall rupture. D. Acute pericarditis. Correct answer B. Papillary muscle rupture. Explanation: Papillary muscle rupture, especially from an inferior MI due to RCA occlusion, leads to severe mitral regurgitation, causing pulmonary edema and a new murmur. 10. Which medication is contraindicated in a patient with an inferior MI and hypotension? A. Aspirin. B. Clopidogrel. C. Nitroglycerin. D. Beta blockers. Correct answer. C. Nitroglycerin. Explanation. Inferior MI is often due to RCA occlusion, which can affect the right ventricle, RV. RV infarcts are preload dependent, so giving nitroglycerin can cause severe hypotension. Treatment. IV fluids to maintain cardiac output. Key takeaways for myocardial infarction in the Revalida de Medicina de Puerto Rico. STEMI localization on ECG, inferior MI RCA, ST elevation in 2-3 AVF, Anterior MI LED, ST elevation in V1 V4, Lateral MI LCX, ST elevation in I AVL V5 V6, Posterior MI, PST depression in V1 V3, ST elevation in V7 V9. Cardiac biomarkers. Troponin I is the most sensitive and specific, remains elevated for 7 to 10 days. CKMB is useful for detecting reinfarction. Management of STEMI. Primary PCI within 90 minutes, best treatment. Thrombolysis if PCI is unavailable within 120 min. Post-MI complications. Papillary muscle rupture. Severe mitral regurgitation. Ventricular free wall rupture. Tamponade and sudden death. Dressler syndrome. Autoimmune pericarditis, weeks after MI. Would you